Hello, my name is Damgira Charlotte, and today we are going to talk about anxiety disorder. And mainly, we are discussing generalized anxiety disorder. Now, generalized anxiety disorder is characterized by excessive, exaggerated anxiety and worry about everyday life events with no obvious reasons. Now, people with symptoms of generalized anxiety disorder can't stop worrying about health, family, money, work, or even school, that is if you're a student, and they also tend to expect disaster. Now, some of the symptoms of generalized anxiety disorder include sweating, muscle tension, tiredness, nausea, headaches, visiting the bathroom more frequently than the usual, and trouble trying to sleep and also staying asleep. Now, a practical example of generalized anxiety disorder. I think you've had some people saying that they feel like their legs are breaking or they are crashing or they feel jerry-like, or sometimes they feel like, they can't stand. Now, that's a practical example of generalized anxiety disorder. Now, the cause of generalized anxiety disorder is not fully known. However, there are some factors such as environmental factors, brain chemistry, and also genetics. Now, genetics, this means that the disease or that the generalized anxiety disorder can develop in families. However, whenever we say that someone is genetically vulnerable, it doesn't mean that it's automatic you'll get that disease just because you have a relative that is suffering from that disorder. It means that you stand a high risk of getting that disorder too. That is, if in your family you have someone with that disorder. Now, another factor is environmental factors. Now, environmental factors such as stressful events. This can include changing a job, changing your state, changing your school, and divorce or abuse. This can also cause generalized anxiety disorder. Now, the last factor we said was brain chemistry. Now, generalized anxiety disorder has been associated with abnormal functioning of nerve cell pathways that connect to particular brain regions involved in thinking and emotions. Now, that is to say, if pathways that connect to these particular brain regions don't run effectively, then it means a problem related to anxiety can result or may result. Now, something else that we're going to talk about under anxiety or anxiety disorders are phobias. They are what we call specific phobias. Specific phobias is a group of anxiety symptoms brought on by certain objects or situations. Now, specific phobias, these are lasting unreasonable fear of certain objects or situations that usually don't cause damage that usually don't cause damage or cause very little damage. Now, there are some phobias, and these phobias, there are different phobias, but these phobias are based on what you fear. For example, there are situational phobias, there are environmental phobias, and there are also animal phobias. Now, animal phobias, this is the most common specific phobia, where people can fear animals such as dogs, insects. Yeah. Now, you've heard when someone fears a dog, even when these dogs are not harmful, they'll fear this dog. Whether it's harmful or not, they just fear it. Now, there are also what we call environmental phobias. Now, environmental phobias, environmental phobias, these are related to when you fear, for example, okay, they are environmental related. This is when you fear maybe storm, It could be lightning, it could be water. You've seen some people who can't even, sit on the board. Yeah, I mean, they fear water. Generally, they fear water. Yeah. Now, then situation phobias or situation phobias. This involve fearing to drive a car. It could be fearing to drive a car. It could be fearing to go over a bridge. Now, the cause of these phobias is also not specifically known, but we have associated this has been associated to the fear or experiences that someone might have learned with these different situational objects. Probably we can give an example. If you've ever been bitten by a dog, then the probability is high that you will develop a phobia for such an animal. You tend to fear that animal. You'll tend to avoid that animal, with great distress. Yeah, and that is what we have today about anxiety disorders. And not forgetting, I want to remind you that I'm not a medical doctor. These things that we discuss on this channel are mainly to increase the awareness about mental illnesses and also give you an insight. Yeah, so just in case you find out you have a mental disorder, please go and seek medical attention from a medical professional. More so, yeah, a psychiatrist, because those are the ones that are really meant for mental disorders. Yeah, and not something else. We have a positive